All right, so today we're going to try to cover a little bit of chapter 1 that talks about management. How do you guys define management? Don't use what's up here. In your own mind, in your own thoughts. Yes, ma'am.
Delegating tasks.
All right, delegating tasks.
Subordinates.
That's a good one. Anybody else?
What you do affects everyone.
All right, what you do affects everybody. Remember, participation is 25%. Anybody else?
Properly dispersing the workload, like among whoever you're delegating to.
Okay, so properly dispersing, keyword properly. Anybody else? All right, so by the way, all your responses are correct. I think, I consider all of those things to be important to management. Here are a few more that are also discussed in your book. So we have planning, organizing, staffing, controlling, directing, and decision making. So planning is probably one of the most important out of all of these management. Because without planning, there's no order, right? If you have duties and tasks for your staff to do, but you haven't planned it out, what's gonna happen?
I don't know what to tell them.
What's gonna happen? Could two people do the same thing, the same task? If you don't plan it out, you might have multiple people doing the same thing, right? What else might happen? You might lose money, right? If you're wasting time because things aren't planned. So a lot of different things can happen, bad things, without planning. Organizing, just as important. You can have a plan, but if that plan isn't organized, what happens? Misplaced chaos. Let's say our plan is we're gonna pick up the trash out here in this parking lot. I just picked anything out of my head. All right, so our plan is to clean up the trash in the parking lot. So if I were to tell you guys, all right guys, we're gonna go clean up the trash in the parking lot and that was it. Would you guys know what to do?
No.
As opposed to me saying, all right, this column, you guys are gonna clean up row 1. This column of students, row 2. This column, row 3. Now I've started to organize what we're gonna do, right? So that we don't have the same people doing the same things, and there's no overlap and no time being wasted. So organizing is just as important. Staffing. Staffing has to do with getting our staff together. So again, if we stay on the same example, we're cleaning up the parking lot, and I say, okay, you 4 ladies are gonna clean the parking lot. Well, what if we have a really big parking lot? I haven't done my staffing correctly, right? Maybe I should have said, you 4 plus this row, right? So staffing deals with making sure you have an adequate number of employees to make sure you can take care of all the tasks and duties that are related to the job. Now controlling. Does anybody know what controlling is?
Supervising, kind of.
Supervising, a little bit, yep. It's involved in controlling. Anything else?
Making sure everything is right.
Making sure,
Everything goes right.
okay, making sure everything goes right. What about monitor? You monitor people when you control them, perhaps? Our last class, one student said that she kind of felt that micromanagement could be a form of controlling. What do you guys think?
Yes.
Possibly.
Worst thing.
This is a quick yes. Have you been micromanaged before? So you understand? I think we all probably been micromanaged. And then directing. So directing kind of deals with, somebody talked about delegation. Was it you? So directing somewhat deals with delegating and making sure that you have appropriately assigned the right people to the right tasks. And decision making. Decision making is important, but it's very important in healthcare because it's always changing. Every day is different, no day is the same. We may have 20 patients come in one day, we may have 2 the next day. So an effective manager has to be very good at decision making, being able to think on their feet quickly, being able to not just come up with a decision, but come up with a sound and reasonable decision. So decision making is very important when it comes to management. All right, what management skills are needed to be successful? The book talks about 3. You have conceptual skills, technical skills, and interpersonal skills. Does anybody know what conceptual skills are? I'll take you, Ms. Pearson.
The ability to critically analyze and solve complex problems.
Great response, great response. what were you gonna say?
I would say kind of like, usually for like every mission or task you have a concept, like an overall mission statement, kind of like that. Like
Right.
why you're doing what you're doing. So you don't want to just send your people out there to do something they're like, they don't even understand why they're doing it.
Right, so conceptual deals with the mind. It's kind of a mental thing a little bit, so that you definitely have to have conceptual skills. What about technical? All right.
I would say technical is more so like, say you have someone that maybe has asthma, you can't send them out there in like the dead of August in Fayetteville because they could have asthma attacks. Technical is more so making sure that the people that are doing the task are able to do the task. They're like qualified to do the task.
Right, so it deals with qualified. So
I don't know if I gave the
we-
best example.
If we think in terms of our nursing students in here, technical skills would be your ability to be a good nurse. So your ability to be able to take vitals and perform whatever procedures you need to on your patients. That's your technical skills. So while you may be in management, you still have to have those technical skills even if you aren't working with patients every day. Does everybody understand that? Why is that important?
You can't expect your subordinates to do something you can't do. It's hard
Right.
to teach them.
It's very hard to manage other people if you don't really know what they're doing or how they do it. So again, even if you're at a management level and you haven't provided patient care for 2 years, you still need to have those technical skills to be able to do it if you need to. Not only because you can't expect your subordinates to do it, but what if you have 5 people out because they have a flu? And the manager has to step in and actually care for patients. So it's very important to have those technical skills. If we think in terms of our HMT students, it's just as important. You still have to have those technical skills, you still have to have those writing skills, those financial skills to be able to calculate your budgets, even if it's not your job to do the budgets. When I worked in hospital, I didn't work in the financial department, but there were times when I had to develop budgets. So that meant that I still had to have those technical skills to know how to develop a budget, even though it wasn't something I did every day. Now, sure, after I developed my budget, it went through several people to be reviewed to make sure I did it correctly, but to do it initially, I had to do it. So I had to have those financial technical skills to be able to do it. And then the last one, interpersonal skills.
Being able to communicate with your subordinates.
Being able to communicate. You sure that's what you wanted to say? Because the last one was so robust.
To be able to communicate and work well with others.
All right. You want to add on to that?
Effectively communicate.
Effectively communicate. All right, all 3 answers are good. Interpersonal is just how it sounds. It deals with people, working with persons or people. So you have to have the ability to be able to relate to your employees. You could be an exceptional manager. You could have great conceptual and technical skills and still not have good interpersonal skills and be a poor manager. Because you can be as smart as you want to be, you can know as much as you want, but if your employees hate you, you will not succeed. Any other comments about these skills? All very important skills. All 3 are very important. We're going to talk a little bit about management positions. Because I know a lot of you guys are new to healthcare management. So there's different types of management positions. You have horizontal, vertical, and matrix. So with a horizontal management, it's an organization that is considered to be flat. They call it a flat organization. So that basically means there's only certain levels, only a couple of levels within that organization. So for example, I worked for a firm that was flat, that was horizontal. So we basically had 5 principals or 5 bosses, and then everybody else reported to them. So it was just 2 levels within that organization. So if we had an organizational chart, there would be 2 lines and that was it. So that was a flat organization or a horizontal organization. A vertical organization is probably more common to what you guys have seen. This is where the organizational chart has multiple levels, so you'll have a supervisor, then a manager, then a department manager, then a vice president, then a president, then a CEO. So those types of organizations have vertical management positions. So it's not flat, it's more tall or vertical. And then a matrix management position. Anybody know what a matrix management position is? It's a management position that may have employees from different departments. So a matrix manager may supervise folks in respiratory therapy, cardiology, and pulmonology, for example. That would be a matrix manager because they manage people from different departments. Another example of a matrix manager could be a project manager. For example, in the past, I've been project manager on different projects, and I had people from different departments reporting to me for that project. So I had people from nursing reporting to me, people from finance reporting to me, people from building construction reporting to me. So it was different people from different departments reporting to me as a project manager. So those are examples of matrix management positions. Okay, within management, there's 3 levels. We have management of self, management of a team, and management of an organization. So the first one, management of self. What do you guys think that means?
Time management.
Okay, that could be one part of it. Time management.
Maybe like making sure, like you said, if you do have to fill in, making sure your certs are always up to date, making sure you are doing like, because usually when you're a manager, like you have to kind of like oversee everything, so making sure like charts are good or just.
Okay, so making sure you're up to date on all of your stuff. Anything else? Any other examples? Both of these examples that they provided are correct. Basically what this concept is saying is, even though you might be a manager, you still have to manage yourself. You have to be together before you can require things from other people. So you do have to be up to date on all of your stuff. You do have to be able to manage your time. You have to be able to manage yourself to be an effective manager to other people. If you arrive to work every day, 30 minutes late, how are you going to manage your employees, right? So you have to be on point. You have to be able to manage yourself in order to be an effective manager. The second level is management of a team. So this would be where you manage your employees or your department, or however you define that team. But before you can get here, again, you have to have management of yourself. And then you can have management of your team, and obviously that's where you are going to serve as the manager or the leader of that team and direct that team to whatever goals you may have. And then the third one, management of an organization. Now, depending on what type of organization you're in, whether it be a physician office or a physician practice or a long-term care facility or a hospital or a dialysis facility, whatever it may be, all organizations are different. Some are small, some are big, but you may get to a point where you're managing an organization. Maybe you're the practice manager of your physician office. If that's the case, you have to be at all of these levels. You have to manage yourself, you have to manage your team, which is going to be your staff, and you're managing the organization. So this is what they mean by tri-level management focus. You need to have all of these things in place to be able to manage effectively. Any questions about this concept? All right, what else do managers have to do? We have to find good people. How many of you guys have worked somewhere with other people and been like, how did they get hired? By a show of hands. Almost everyone in this room, including myself. So, how does that happen? That happens because the manager probably, I'm not going to say they did because I don't know the situation, but more than likely, the manager did not recruit, develop, and retain good employees. These are the things that must happen. Training. Training is very important because how you train someone is how they're going to perform. If you train them wrong, then they're going to perform wrong. If you train them well, they're going to perform well. Leadership development. Leadership development involves developing the employees that you hire. Now, there are situations where some managers may feel like, I don't want to develop you because you may come and take my job, right? That's not being an effective manager, because holding an employee back is not benefiting anybody. It's not benefiting the employee, it's not benefiting you, it's not benefiting the organization. So it's very important that you don't have that mentality and that you do try to develop your employees. I would not feel good about having, and I'm just picking on you because you're right here. I would not feel good about having you as an employee and you've been in the same position for 10 years. That would not make me feel good as a manager. I want to see you grow and develop and move on up into higher positions and not just be complacent in your same position that you've been for 10 years. That's not doing a good job at leadership development. So leadership development is key. Employee feedback. Without feedback, we don't know if we're doing a good job or not. If you tell me, you know, you're really hard on us and a lot of people don't like you, and I may not want to hear it, but it may be feedback that I want to hear, that I need to hear, so that I can get better. And I think a lot of times managers will dismiss the feedback from the employees. It's not always right. Employees are not always right, but sometimes they do have really good feedback. And if you don't even allow employees to give feedback, that won't allow you to be an effective manager. I've worked places where we never had the opportunity to give feedback, never had the opportunity to speak out, and it doesn't make for good employee morale. No one wants to work anywhere where they feel like their voice can't be heard, right?
Right.
So, so that's employee feedback. Conduct rounds and office visits. Sometimes as a manager, you will have lots and lots of work to do. You may feel overwhelmed and feel like there's not enough time in the day and that you just have to stay in your office. I gotta stay in my office, I gotta get this work done, I gotta get this work done. But conducting rounds is very important for a few reasons. It allows you to be visible. And when you're visible, you're oftentimes perceived as being more approachable. If you're always in your office with the door closed, your employees aren't going to feel comfortable with coming to you to talk to you, to give feedback, or to tell you about an issue that they're having that may be preventing them from doing their job correctly. So what the rounds does is allows you to walk around, you know, how's your day going today? Are you guys busy? Do you think you need extra staff? Do I need to call someone in? Rounds helps you get that kind of information. When I worked with administration in the hospital, we would do rounds about twice a month. And we would go to different floors. We would round on different floors. We would split up, all of us administrators, and we would each take one floor. And so we would walk around on that floor, talk to the nurses, talk to the staff, talk to the physicians, get input, see how everything is going, and then come back as a collective group, all the administrators, and sit down and discuss information that we got. And a lot of times you get really good info and feedback from conducting rounds. Sometimes you get gossip. You get everything when you conduct rounds. You may find out that you need to order a different type of toilet paper for the bathrooms because the toilets keep getting stocked up, which is plumbing bills. So you find out all kinds of stuff when you conduct rounds. So rounds are very important. You want people to see your face. You want people to see that you're a good person. You want people to see that you are a person and not that you're not just a manager, that you are actually human, personal, somebody that people can talk to. And then succession planning. Succession planning kind of links to leadership development. It deals with the act of planning for when you leave. And by leave, I mean leave your position, whether that be retirement, upward promotion, or leaving to go work somewhere else for another company. And succession planning deals with working with an individual or several individuals to basically train them to be you. So as you're developing your staff, there's always gonna be some people that rise above, that stand out to you, that you wanna reach out to, that you think you would be good mentors for. And those are the people that you think of when you're doing your succession planning. So I may say, I wanna groom you so that you can take my position when I leave. And that's basically what succession planning is. And this is what good managers do. Poor managers don't do succession planning, and then when they leave, everything falls apart. So a good manager is gonna make sure that they have a good succession plan in place. Any question about these? All right. Managing performance. Everybody knows what performance is, right? It's basically what we do in our job. So if we go back to my example about cleaning the parking lot will be our performance. So when you're managing performance, you want to emphasize efficiency and quality. So that would be me saying, all right, we need to make sure this parking lot is done in 20 minutes. That's me trying to be efficient. Now, if I just say, take however long you want or however long you need, you guys can be out there for hours, and that's not necessarily being very efficient. And then as far as quality, I want to make sure you guys do a good job. I don't want to see cigarette butts that got looked over, or Coke bottles that didn't get picked up. When I go out to check the parking lot, it should be a high quality job done. All the trash should be gone. When you're managing performance, you want to highlight the people who go above and beyond. So if we're cleaning the parking lot and this young lady does an exceptional job, her bag is like filled with trash. It's like bulging, like about to explode. She's picked up so much trash. I want to highlight her and say, wow, you did a great job at picking up all this trash. I want to commend you. So you want to highlight your high performers. And the way you do that, it will be up to you. You may want to recognize that person in your staff meeting. You may want to give them a gift card. You may want to give them a certificate. You may want to tell your boss so that your boss can recognize that employee. Whatever it may be, you want to recognize those that go above and beyond. You want to set reasonable and appropriate goals. So maybe I said, okay, you guys clean this parking lot in 15 minutes. Maybe that wasn't reasonable. Maybe the parking lot is way too big to finish in 15 minutes. So as you're managing performance, you have to think, is what I told them to do reasonable? Is that really feasible? Or was it not feasible from the start? And last but not least, you want to utilize benchmarks and organizational comparisons. Does anybody know what benchmarks are?
Set standards.
Standards? Okay.
Maybe by like February you want the organization to be at a certain point or something like that.
Somewhat. Between the two of you, you are kind of on the right path. A benchmark, it is a standard, and it could be something that you set. So if we stay on the same example of the parking lot, I could say, and I'm not going to say any names, but I might say, well, there was a group at another local university or college that did their parking lot in 12 minutes. That would be a benchmark. So then I would say, so let's try to do ours in 12, or let's try to do ours in 11. So a benchmark is kind of the act of comparing you or yourself or your organization or your staff to something else or some other group to see where you stand. You could either be better than them, you could be worse than them, or you could be along the same lines as them. So maybe we both clean our parking lots at the same time. Management and policies. Does anybody know what external environments are?
Maybe like you work in a certain facility and you have your set of rules, but the facility also has their like overall general set of what you're supposed to be doing.
Okay, so somewhat, you're on the right track. An external environment might be If we're working in a hospital, it might be our community, the community that the hospital is located in. Might be an external environment. It could be the city. It could be the state. Why do you think it's important to know or have knowledge about our external environments? We want to know what's going on in our community, right? We want to know, I mean, just on the radio, I think it was yesterday, I heard that there's been like, I don't know, like 22 people in the state that have the flu or died from the flu. That's important. Those types of things are important for managers to know because that may directly affect your organization. That means you may have a higher influx of patients coming in with the flu. Be prepared. Make sure you have enough vaccines, et cetera, et cetera. So it's great to know what's going on within your hospital. It's great to know what's going on in your internal environment, in your organization. But it's equally important to know what's going on outside, externally. It's great to know what's going on down the street at your competitor. It's great to know what's going on in your city, in your county, in your state. And the reason for that, or one of the reasons for that, is because there may be things going on, policy changes, epidemic outbreaks or whatever, that again could directly affect your organization. Another example of this is the Affordable Care Act. Knowing what's going on in our country, which is another external environment, is going to directly affect our organization. It's going to affect the patients that are coming in. We may get more patients as a result of more people having access to care or to insurance. It may affect us financially. Our budgets might get cut because the government may cut Medicare or Medicaid or whatever it may be, TRICARE. So it's also important to know what the government is doing as far as policy changes because they can also affect us. And I'm gonna stop here. So we're almost done. Don't have enough time to do much else. Does anybody have any questions about what we talked about today?